Social distancing at the Chamber, Friday night edition. My name is Garrick Taylor. Glenn, happy hour with Hammer, Friday night. Welcome to the show.
Good to be back on.
So let's do a wrap up. On Thursday night, we posted our conversation with Congressman Biggs, so we did not do our usual reaction to the governor's weekly press conference. At the press conference, he went through the increased testing protocols. As the Chamber's been blasting out on social media, we have a major surge test going on in South Phoenix and the West Valley, thanks to some help from some federal partners. ASU dramatically upping their game with the saliva test. So a lot of good news happening in the West Valley. The governor also announcing some news when it comes to tenants and landlords. And then finally, stay tuned on a school reopening, at least when it comes to the in-person date. So a lot was put out on the table. Any reactions to what the governor had to say yesterday?
The testing part is extremely important. We need to make sure that people realize that the testing is ramping up. This is real. We should be well over 30,000 a day by the end of the month, over 60,000 a day by the end of August. And we'll talk a little bit more later about schools. So this is one where this was very well done in terms of our progress. People need to keep in mind, you could Google it. There's really no place where there's a surge where testing is perfect today, anywhere that I'm aware of. So the governor, working with our federal officials, working with our private and public sector, with Sonora Quest and with Arizona State University, and on antibodies earlier with University of Arizona, we are getting ourselves in a much better position, and I believe soon we'll be in actually a good and stable position on testing. And that's a lot of work, and it's an absolute must-have in terms of living with the virus and being able to even open up some of the things that have been paused, and to get to any sort of regular in-person schooling at a reasonable level. I don't believe you could get there without really a robust testing regime.
There was some good news this week, and I stress some because the numbers were trending in a better direction. An uptick today, Friday, but some observers have said there's been at least a slight plateau. The point you've made, though, Glenn, is that the plateau is still too high. We have to keep our foot on the gas and continue to bring it down.
So earlier today, the U.S. Chamber, through their foundation, they had another one of their Path Forward virtual meetings. The president of the U.S. Chamber of Commerce, Suzanne Clark, I'm calling her the business Oprah, interviewed Dr. Anthony Fauci.
I've heard of him.
We've heard of him. Now, here's a little bit of news that I wasn't aware of until later in the day. That has already received over 1 million views.
Really?
Over 1 million views. So just think about that, that platform, and that will go up because it's being covered by national media and local media across the country. So over 1 million views. I mean, so think about that. That's more than any cable newscast in America in terms of the number of eyeballs that have been on that thus far. But what the good doctor said, and it's really important, is the importance of citizens doing their part. Government can only take us so far. And it's the big three. It's social distancing, it's washing your hands or using Purell, and it's masks. And Dr. Fauci emphasized the mask part, because if we're going to have open commerce where humans are going to be around each other, masks are the number one thing we can do to stop the transmission.
Let me ask you, Glenn. It's not just the CDC, but also health authorities at federal level, like the Surgeon General and HHS authorities, have said, if everybody wears a mask, life could look dramatically different in a good way in 6 to 8 weeks. Did you get that same impression from Fauci's conversation today?
I would say that he didn't quite put it in those terms, but I would say that as the number one mitigation measure that will really help contain this. It's along the same lines.
Yeah.
I would say the doctor went in that direction. And, he emphasized that this is something that's really, it's state by state, it's locality by locality. But I thought what was really interesting is time after time, he really stressed the importance of the citizenry doing its part through this pandemic, and that's something that chambers, we could get sick of just saying this over and over and over and over again, but we need to, because is wearing a mask a silver bullet? No, but it's a bronze bullet. It's a way that if two people are wearing a mask properly, the odds of transmission, they're not zero, but they become very, very low. And it's really, when it comes down to it, it's if we want to prevent our hospital system from being overloaded, if we want to reopen some of the parts of the economy now that have been paused, and if we want to have in-person K through 12 instruction at a reasonable level, the citizenry is going to have to wear masks. There's no other way, unless we're going to wait for great therapeutics or a vaccine.
Glenn, a lot of debate around the country and in Arizona about the necessity of mandates. About 90% or so of Arizona is already under a mandate. But in case anybody's watching this who needs an invitation, if you're living in an area that's not under a mandate, wear a mask. As Glenn has said, that is the number one mitigation tool. So mandate or no mandate, you can help stop the spread.
And I'm really thrilled that a number of the larger companies like Walmart are saying, you're not coming into our stores if you're not wearing a mask. You need to wear a mask, and we would support any sort of effort to continue to ratchet it up in Arizona. 90% is very good, and I would imagine that the public compliance will continue to improve. It's already, I would say, at a very, very good level, just anecdotally. But I'd love to see Arizona get to 100%, particularly while we're at this elevated state of infection.
Glenn, at the press conference, as well as the conversation that we had with the Council of State Chambers earlier today on a webinar, and perhaps it came up on your webinar with Dr. Fauci, you can tell us, looming large now is the return to school. For many people, we are in the T-minus countdown of the return, and things are still very much up in the air. The governor announcing that he'll have news on this soon. What did you hear today from national leaders about this topic?
Well, I had a number of calls, and Dr. Fauci did address this school issue, I believe, briefly. And the preference for all of us is in-person learning, but local conditions are going to control what happens in terms of in-person learning. So I'll say this flat out: dates are absolutely meaningless in the sense that if the virus is raging, and your hospitals are near capacity, you're not going to be breathing any additional oxygen in any area into your economy. The good news, though, is that you mentioned at the start of our broadcast, is that it does look like the numbers are turning for the better. From a very high level, let's not sugarcoat it, from a very high level, but the trajectory seems to be, over the last week or so, maybe even a little bit longer, the right one. But we have to continue to do these mitigation measures, and we will be able to open up our K through 12 system if the localities feel that that is the right decision later this summer or very early fall. I'll say personally, I don't see much in-person learning before Labor Day, but I do believe that somewhere between Labor Day and October 1st, if we all continue to do our part, we will have a significant portion of our K through 12 students, particularly in the younger grades where the transmission seems to be the lightest, back in the new normal, a term the governor used several times during his press conference.
Yeah, there are lots of difficult choices ahead, and we've talked about throughout this pandemic the role of federalism, but also local control. And I will admit that as somebody who, on many times I endorse local control, other times I can't stand the patchwork of policies. I note that next week you're going to be a guest speaker on a webinar for our friends at the Billings, Montana Chamber of Commerce. I'm going to bet that their issues are just different than, say, Houston, Texas. And that's where we get to the need to calibrate around local facts on the ground.
Yes, and it's interesting, though. The reason why I'm being asked to speak at this Montana chamber event, the Billings, Montana chamber event, is because of our work on masks. They look at some of the things that have happened in Arizona in a positive way, that localities have, by and large, adopted these mask mandates, as well as the letter that I signed that the U.S. Chamber led, calling for a nationwide standard on masks, but localities and states to offer mandates. You know, again, I don't care where you are on the planet, and we've talked about this, Garrick.
Yeah.
I don't care where you are on the planet. If the virus is making its way around, you have to have masks. And, you know, I heard this from a colleague today who runs a great chamber, the Salt Lake City Chamber, one of the great chamber leaders. And his line, and I'm paraphrasing it here, wearing a mask is a small price to pay to keep the world's largest economy open. That sort of sums it up.
Well, just to go over a point that you brought up, I think that your colleague in Salt Lake City makes a good point, is that it is very difficult for the rest of the Arizona economy to operate at full strength when our healthcare system is teetering on the brink. It's also going to be extremely difficult if that remains the case to get kids back in classrooms. So to your point, we're going to have a delay in in-person instruction, but it doesn't have to be a forever thing. We can turn this around.
And what I'm also very encouraged by is that the U.S. Chamber, which in my view is the most effective advocacy group in the world and a force for good, they're digging into the K through 12 space. Okay. So out of the 5 areas that they've identified in CARES Act Part 4 that's going to move forward most likely later this month and early August, on that top 5 is K through 12. And, you know, I expect that part of that will be, you know, certainly a push for additional resources. And Garrick, to me, that's one where our federal government could really step up and help make sure that every school in America has the resources that it needs to safely reopen for in-person learning, and when it's not possible, to provide additional funds for distance learning and things like that.
So Glenn, when you mention resources, it sounds like you're not just talking about dollars and cents, though. You mentioned the technological tools that are needed, and I would imagine also PPE.
The PPE is a big part of that. We need to make sure that all the kids have, and teachers and support staff, that they all have masks. A lot may want to have thermometer monitors. Some may need plexiglass. There's going to have to be different space configurations, although that's a little bit up for debate. So there are, and Purell and hand washing soaps and disinfectants and all that kind of stuff. But, you know, the good news is we could get there. And I also like looking, and we've talked about this, are the types of permanent changes we could do that will be positive today, tomorrow, and 100 years in the future. And you think about washing hands and making sure you're not spreading germs. And so some of these protocols I do believe will be helpful in also reducing other illnesses, such as kids catching the flu and other sicknesses. I mean, I don't know about you, Garrick, but with my kids, if there's something going around, I mean, doesn't matter what it is, it tends to hit a lot of kids and adults. So
right. Yeah. You know, Michael Petrilli, you know, is a commentator with, he's a Fordham, isn't he? Yeah. And he was proposing today that, and you've brought this issue up, do we need to rethink the school calendar entirely? And one of the comments that he received was, well, before we lock ourselves into a date, we need to make sure that the science tells us what we need to hear. So similar to what you've brought up.
it's not going to be I think we could have dates that are aspirational. So it's not what I don't want to see happen is well, we can't open in August, we can't open Labor Day, let's just write off 2020. That to me would be a mistake, because the evidence is very, very clear that kids by and large learn much better in person, and we just have to keep sticking together to work towards that goal. And my hope and expectation is that Governor Ducey and Superintendent Hoffman, a Republican and a Democrat, will continue to be model leaders on education and continue to collaborate and work together. Because when those two are together, it's going to be very helpful, because they're two different political parties, to keep the public behind them. And I'll just say, on the chamber front, we're going to do everything we possibly can to help make sure that schools reopen safely, that the distance learning is as good as it can be, and that we're making sure we're doing this in a way that doesn't cause problems for right now, in this point in time, this second in time, a overstretched or a hospital system that is way too close to capacity.
Right. Yep. It's an important point. All right. Well, let's hope that these numbers continue in the right direction. Don't do anything this weekend, viewers. You are safer at home. So stay home. All right.
We're making progress. You said it well, Garrick. Let's just stay at home, enjoy our families, and we had a better week than we've had in a long time. So let's continue to, and still obviously a lot of tragedy and sickness, but let's keep moving in the right way, and we'll get back into a path where people can safely go to school, go into commerce, and have some sort of semblance of life in the new normal.
Right. All right. He's Glenn Hammer. You can follow him at Glenn Hammer on Twitter. Glenn, we'll see you next week.
Have a great weekend, Garrick.